Great. Thank you, Bridget. And welcome everyone to today's educational session on realizing the value of enterprise imaging. My name is Frank Pecaitis. I will be moderating today's session. And I am the market leader for Philips North American market for our Enterprise Diagnostic Informatics business. Joining me today is Dr. Cheryl Pertersilge, who is the Chief Executive Officer for Vidagos Advisors. Cheryl, would you care to give us a little bit of a background on yourself before we begin today's presentation?
Sure. Thank you very much, Frank, for including me in this webinar. Enterprise imaging is a topic that I am very passionate about. I began my own enterprise imaging journey at the Cleveland Clinic, where I oversaw integrated content, which included the enterprise imaging program, and was involved with that from its inception. So had the opportunity to grow and learn at a time where there was very little guidance about enterprise imaging and how to go about achieving such a program. The program there is quite successful, and I have now embarked on a new journey with Vidagos Advisors to help other healthcare organizations, industry, and the government understand the importance of enterprise imaging and ways to achieve a successful enterprise imaging service in their organization.
Thank you, Cheryl. Well, it's great to have you and your experience for this session to join me in covering 3 learning objectives today. First and foremost, to, so to speak, demystify enterprise imaging. The term is widely used in the industry now. It's a more contemporary term, and there's still lots of ambiguity about what that truly means. So we'll cover that today. And what's most important to healthcare executives today is really making sure that the investments that they're making in information technologies or informatics technologies are really lining up to deliver quadruple AIM value. And we'll focus on how enterprise imaging can be applied to the business of healthcare and achieving quadruple AIM KPI success. And last, we'll talk about the new and evolving adoption of enterprise imaging technologies as it relates to HIMSS digital imaging adoption model maturity scales. We have maturity scale for the electronic record we call MRAM. We're going to cover that today as well, so we can connect the dots, if you will, to how that's important as it relates to enterprise imaging and quadruple AIM. So before we get any further, I wanted to set this up with that fundamental question, Cheryl. What is enterprise imaging from a definitional standpoint, and why is it so important?
Thank you. So we're going to start with the HIMSS enterprise imaging community definition of enterprise imaging, because to me this is where it all begins. And it's really a set of strategies, initiatives, and workflows to help you capture, index, manage, store, distribute, view, and exchange, as well as analyze all medical imaging and multimedia content that occurs in an organization about a specific patient. And the goal of that is to really complete the electronic health record. Because if we think about the ultimate goal of the electronic health record and consolidating all of this information is to have a single gold standard source of information about the patient. We've been really successful doing that with a lot of the textual information, progress notes, operative notes, a lot of other pieces of information that resided in the previous paper chart. We're really now on the next part of the journey, which is taking all of that imaging information that resides in a number of different silos across the organization and making sure that that is available to all people who are interested in caring for specific patients. People, lots of times when they say imaging, go right to radiology, and maybe some people will go to cardiology. But as we've embarked on enterprise imaging journeys, we know that almost every single medical specialty engages in generating some form of medical imaging. When we think about photographs alone, with the ubiquitous use of smartphones, pediatricians are taking photographs of rashes, ED physicians are taking photographs of wounds, patients are taking videos of themselves at home and sharing those with their providers. So everyone, including the patient, participates in generating these images. And what enterprise imaging is doing is providing us with all of the functionality to comprehensively manage those. So a single central archive, one archive. We'll talk about later the values of that. Encounters-based workflow tools. So a lot of imaging is done in the point of care mode. So we have a lot of these new mobile ultrasounds that are being utilized throughout the enterprise. And we don't want that information sort of floating out in a means that's not acceptable to or accessible to the clinicians taking care of the patients. We've talked about photographs. So we have tools to be able to bring those types of images into the enterprise imaging archive. Universal viewer, so your clinicians use one viewer and can access all of these images. And those viewers are getting smarter and smarter, and the line between diagnostic viewing tools and the universal clinical referential viewer is starting to blur. They're becoming more and more the same. Image exchange, very, very important part of managing medical imaging for the purposes of continuity of care. Patient portal, so the patients can both access their images and share their images, and then analytics to help us understand what's all happening in our medical imaging universe. All of these are very important functions for enterprise imaging. And lastly, if we really think about it, some people might say, why do I need the images? Or why do people need my images? That's my data. I have the report. And we saw radiology start out with that question a while ago, and they've really grown to understand the importance of combining radiology images and the report together. Cardiology's on that same journey, and many of our other specialties have just embarked on that. But let's just take a minute and think about this. You don't need to read the whole narrative, but if you look at this, this is a narrative that you might see in a guide through a specific museum, and it really has a lot of detail about this painting, but can you conceptualize that painting in your mind? I certainly couldn't, but when you get that image together and you get the painting together, it's much more powerful than either one alone. When I was in the Louvre and looked at this picture, I was like, okay, great, I'm here. I don't understand what's so important about it. I'm not moved. But when I understand and can read about the painting and then look at the painting, I have a much, much greater appreciation than I would with either one of those alone. So, you know, images really, really are a very, very important piece of the patient's medical record.
Cheryl, I love that illustration to really bring forward the importance and relevance of having all that information together for the clinician. Let's dive into the Quadruple AIM. How does enterprise imaging connect to the Quadruple AIM?
Well, first, let's just take a moment to review the Quadruple AIM. And really, the Quadruple AIM is the guiding principles that will help an organization achieve success. And that is enhancing the patient experience, advancing the health of patient populations that they're managing, reducing costs, and the new one that took us from the Triple AIM to the Quadruple AIM is improving the provider work life or the provider experience. Because if we don't have happy providers, we're going to diminish the chances that we're going to have happy patients. And when we look at sort of the constellation of the universe around the Quadruple AIM, we have all the stakeholders. So we have the patients, we have the payers, we have the providers, and we have the policymakers. And then we have those technology foundations that are going to be helping us achieve the Quadruple AIM: big data, analytics on that big data, and then the digital transformation. And today, what we're really going to talk about is we're going to talk about the patient and provider stakeholders. Patients come in both the individual form and the population form. And when we talk about providers, we have to use the most broadest definition of that term. So we have the clinicians, but we also have the operational teams that are supporting our informatics departments, and we have other institutions that are also going to be caring for the patients. And when we talk about the analytics, here's where we put AI, and I'm going to call it AI. Everybody can assign their own definition to what AI means, but AI is going to help us with our analytics. And then when we talk about digital transformation, we talk about the electronic health record. We're already well on that journey, but we still have some ways to go. And I always try to make a distinction between the EHR and the EMR, because the EMR is really meant to be just the representation of the notes that were obtained in a physician's office and the orders. Well, the EHR has a much broader definition when you look at healthcare.gov and how the government defines it. It's really all of the information about the patient, and that knowledge is updated in real time, and that information is shareable, which is an important component of enterprise imaging, as we'll talk about a little bit later. And then technologies that are helping drive some of the initiatives, and are also technologies that new functionalities have to be able to support is mobile technologies. You know, mobile is the way we operate in today's world. So we're going to talk about all of these different features as we move through the discussion today. And then when we look at each one of these stakeholders, we're going to look at what are they seeking in their healthcare environment. Patients are seeking value. They're seeking good quality care at the lowest cost. And they're seeking access to their providers, as well as access to their healthcare data. Our clinicians want improved, efficient workflows, and they want improved, efficient delivery of information for decision-making so that they can provide the best care that they can to their patients. And our operational teams, they want everything simplified, standardized, and whenever possible, automated. And with other institutions, we're seeking that interoperability that everyone desires. And again, enterprise imaging plays a role in achieving each one of these goals that our stakeholders desire.
Thank you, Cheryl. So we've covered more of the macro concepts here around enterprise imaging and the importance and value of it as it relates to the broader aspects of stakeholder benefits. Let's dive a little deeper and into the specific clinical and operational areas as it relates to Quadruple AIM improvements. In the clinical areas, way back when, we all remember before the EMR, there was a lot of concern about patient safety, medication management, and the To Err Is Human report that is so famous that drove a lot of the EMR adoption, in addition to stimulus funding, to get us to the point of use of electronic records. There are a lot of areas right now that can be suboptimal in care delivery, whether it's a clinical department or across a healthcare enterprise, because they're not completely enabled in getting all that digital information to the right places, to the right caregivers, et cetera. Can you talk about some examples where these cases of suboptimal care operations are occurring from your experience, because it's in need of an enterprise imaging strategy or solution?
Sure. So I have a great example, and this is a real-life example for myself, and that is point-of-care ultrasound. So one day I'm working covering the emergency department, and a patient comes over for evaluation of pelvic pain, and they have a pelvic ultrasound that's been ordered. And so as our ultrasound, our sonographer performs the exam, they're talking to the patient, and the patient's telling them that, yeah, I have something on my ovary that's been there a couple of years. My doctor has been following it. You know, she doesn't know left ovary, right ovary. She doesn't know what it is. And the sonographer obtains some images, and, you know, we see that there's this complex cyst on the ovary. Now, if I don't have access to those outside images, I don't know, is this something that's a new finding and likely to be contributing to the patient pain and something that needs to be investigated urgently? Or is this the lesion that the patient's been talking about, and it's been there for 2 years and it's been stable, and so if it hasn't changed, it's unlikely to be the cause of the patient's pain, so other avenues need to be explored. And, you know, at the time I didn't have access to the outside images, so I have to render a report that's a little bit more vague than I would like to be, and I'm not advancing the care in the emergency department as much as I might like to have advanced the care in the emergency department. And what's really cool about the image that I have here, I found this on Pinterest, and a patient had posted this image on Pinterest. And what's so fascinating about that is it really reinforces that, yeah, the patients really are interested in their images. They're interested in knowing what their images look like, and we'll talk a little bit further about what the patients get out of it. But they're also interested in sharing their images, and not necessarily with another provider. You know, just lots to be said about this. And then if we take another look at what a point-of-care ultrasound program can do for the entire enterprise. We've just talked about for the radiologist in this particular situation, it can improve the quality of care delivered by the radiologist, which then helps the person that's face-to-face with the patient provide better care. When we look at it at a little bit broader level, among all clinicians, by having a united service through sharing of images, it creates the potential for shared education, shared quality standards, and shared ways of achieving the same compliance throughout the organization, rather than each point-of-care ultrasound program working independently. And one of the big points that I would drive there is even just the naming of the studies when you go to share them. You know, if it's an ultrasound of the gallbladder in the emergency room, then it should be an ultrasound of the gallbladder in the ICU, and it should be an ultrasound of the gallbladder in radiology. Or if we want to call it ultrasound of the right upper quadrant, ultrasound abdomen limited, whatever. Everyone should use the same shared terminology so that those images are identified as being relevant to each other. They can support hanging protocols, support searching and filtering. So just that component alone is extremely important to achieving the goals that we're talking about today. For the operational team, by uniting these services, we have the opportunity for shared purchasing of equipment, which can lead to better purchase prices. It also enables us to have standardized interfaces with the equipment, reducing cost and maintenance, and a lot of other operational efficiencies that are achieved with standardization. And for the patients, it means improved quality. It means access to their images, which strengthen their engagement in their disease process.
Thank you for going into that depth, Cheryl. Let's get into another area here, which is it's a big area of emphasis for us at Philips, and that is precision diagnosis. Although we have had rapid adoption of technologies in healthcare advancements, electronic records, and the like, the industry is still suffering, and our population is suffering from diagnostic errors. Diagnostic errors being late, missed, or incorrect diagnoses. So it's still one of the most important safety problems in healthcare today. Per CIDM, the Society for Improving Diagnosis in Medicine, they note that major diagnostic errors are found in 10 to 20% of autopsies, suggesting that 40,000 to 80,000 patients die annually just in the United States from diagnostic errors. And surveys confirm that at least one person in three has had firsthand experience with a diagnostic error. Furthermore, they're not just surgical mistakes or medication overdoses that account for the largest fraction of malpractice claims we're seeing. So this is a severe problem despite all of the investments health systems have made in technologies. How can enterprise imaging help enable precision diagnosis, first-time right diagnosis, and reduce such errors?
So I'm going to keep up with the airline analogy that we've started with the checklist because it's a great analogy. But if we think about that, that's only about flying one plane. But when we really think about care coordination, so multiple providers focused on one patient, or when we think about taking care of an entire patient population, we really need to be as tightly aligned as the Blue Angels. And how do they operate? They operate on very, very close communication, which requires that they talk the same language. They have to be aware of what's going on with each other. And actually, I believe that a lot of what they do is still manual and visual, that they're not just, setting some kind of computer guidance that coordinates all of the planes. This is still very much a human process, and that's still what's going to go on in healthcare today and into the future. I don't believe, and I really hope we'll never take the human aspect out of healthcare delivery, but we'll actually use the tools that are available to us to augment all of these features. So we're going to talk about image sharing. So that's the information sharing among all of the different caregivers, whether it's uniting all of the medical imaging that's available in an enterprise or sharing information from one enterprise to the other when they're caring for the same patient. There's metadata. Everybody has to talk the same language. Again, using the point of care ultrasound example I talked about, but we need to take that to a nationwide discussion that we all need to be talking the same language, and we're not going to go into it, but there's a lot of efforts today to create some standardization of that language because, unfortunately, even radiology hasn't really come to very consistent, reproducible standards that are utilized by every organization. We have to have governance over the activities that are going on. And we just need to be able to make sure that we're able to support that communication and awareness among everyone involved in the continuum of care for our patients. When we talk about precision diagnosis and we're starting to get into genomics and radiogenomics, that's where we're going to see a lot of advances with AI. And one of the first steps in all of that is having a consistent, consolidated database with clean data, good data hygiene, again, linking back to the metadata. And that's the foundation that enterprise imaging is going to help when we start to talk about radiogenomics and developing patient-specific treatments, a lot of which are going to be based on analysis of their images, among a lot of other information.
Great insights in anticipating what's coming in the future as well. So it will play a key role, no doubt, in helping improve medicine and reducing errors in healthcare. Let's go back into the topic. Some of what we started early on. Traditionally, imaging informatics has been focused in the heavy diagnostic areas of radiology and cardiology with those respective diagnosticians. Can you elaborate on other clinical areas where enterprise imaging can be leveraged to provide measurable impacts on safety outcomes and quality of care?
Certainly. So if we think about it, each of these photos that have just popped up from pop culture, each evoke an entire story for the patient that views the images. We know everything about Spider-Man. We know all about Game of Thrones and the Hunger Games. One image brings up a whole story. It's the same thing, not only for a CT, but also for a retinal examination, for a picture of a patient with Raynaud's. Each one of these pictures tells us an immense story about the patient. So we really want to be able to share that information with all of our clinicians and help our clinicians raise awareness. I also have this future hope that maybe we can use photographs especially to help reduce some of the documentation burden because they are so rich in information. Is it really worth a clinician trying to write a paragraph that describes Raynaud's, or can they just post a picture and share that with all of the other providers taking care of the patient? So, again, back to what I said in the beginning, every subspecialty engages in generating this information, and we're going to impact outcomes by sharing this information. Wound care is a perfect example. Photo documentation of wounds has become a standard part of the way we document and follow wounds. And there's a whole industry developing around how do we adequately take high-quality photos that will help us achieve that mission. And think about it, if a patient comes in to an emergency room that's being followed in a wound care clinic and says, I think my wound's worse, it's seeping, it's more red, it hurts more, whatever. If that emergency room physician has no idea of what that wound looked like 2 days ago, all they have to go on is what the patient is experiencing, and not to discount that. But do they know, is the wound itself really unchanged? Is it minimally changed, or has there been a drastic change in that wound? And they can more definitively direct care, which is going to directly impact the patient outcome and the quality of that visit. And again, if we can intervene earlier rather than saying we'll follow up in wound care on Monday, if we can intervene earlier, we're going to affect the quality of the patient's outcome.
Yeah, interesting to hear how cases can be applied beyond what we traditionally have known imaging informatics to focus on with the evolution of care in so many areas digitally. Let's move towards back to the Quadruple AIM here. Clinician satisfaction. Let's talk a little bit more about how, from a clinician's perspective, enterprise imaging can be enabled to help that metric. Speaking yourself as a clinician.
Certainly. So what does every person that's making decisions desire? They want the right information delivered to the right person at the right place in their workflow. So clinicians work in the EMR, and we want to make sure that they don't have to leave that environment to seek out information about their patient. And so that's really what we desire to do. And so if we think about it, what is the functionality that Enterprise Imaging offers? Patient portals. So it offers the ability for the patient to upload their information prior to their visit, giving the clinician a heads up possibly on what's going on. And I actually just had this, I have a doctor's appointment coming up and, clicked on my reminder and it said right there in the email reminder, if you have any images, CDs, photos or anything related to your visit, please click here and upload them. This way they're processed through the system and they are available to my clinician at the same place as an internally generated image. Perfect example. Image exchange, same thing. If I was seen in an emergency room in Florida, and now I'm being followed up in Cleveland, which is where I happen to live. Through a robust image exchange protocol, my clinician will have access to everything, including the CT scan that was done in Florida. So they don't have to go seek that information out there. It is provided to them. Standard workflows and metadata means that I'll be able to compare all my images because I'll know what images are related to each other. And then the universal viewer means I can go into one place and I can look at the radiology images, the cardiology images, the retinal images. I can look at any photos that were taken of my patient. And again, at the end of the day, this is going to help me provide better quality, more effective care. It's going to make my experience a lot easier because I get everything I need presented to me. And it's going to enhance care coordination because I'm going to know everything about that patient that I need to know to take the best care of them that I can.
Happy clinicians, happier patients.
Absolutely.
So let's look at really back to the Quadruple AIM again in terms of operational efficiencies and reducing waste cost in the healthcare system. Every healthcare enterprise is working the balance of delivering higher quality care at lower cost today. So could we dive into the operational side of enterprise imaging a bit?
Sure. So, when we take this chaotic current imaging ecosystem that we see over, on the left, and we streamline it and move it into one well-functioning ecosystem. And we're going to do that through consolidating all of these disparate archives into a single archive. And we're going to standardize our metadata. And we're going to move all of our image exchange to one centralized function, not, my ophthalmology secretary has to run and find the nurse or MA who knows how to burn a CD. But if we just have it all done out of the archive by one service, we are going to significantly reduce our costs. We're going to talk about this in a moment, but we're also providing opportunities for heightened automation and protection of patient privacy. And then the more we standardize, the more opportunities we can create for automation. Let's just start with automated modality work lists. Radiology already shares that. But what about a clinician that takes photos as part of 50% of their visits? If we can automate that process by providing some form of work list to their smartphone, we're reducing errors of data entry and we're making their workflow more efficient. Lots of opportunities there. Let's just dive into reducing costs, economies of scale with our archives, reducing the number of contracts and licenses we have to manage. We can reduce and consolidate and centralize our management, our operational teams. Anyone in IT today knows that there's a dearth of skilled informaticists, no matter what industry you're in. By consolidating our teams, we can provide better opportunities for retention and skill development in those valuable resources, creating awareness of imaging that's done in other parts of the organization as well as in other organizations is going to reduce our redundant imaging, which is going to become very, very important as medicine moves from volume to value. You know, a new scan doesn't generate more money. A new scan just adds additional costs. And then we are going to hopefully eliminate that mobile media like USB drives and CDs. And excitingly, we are going to create opportunities to generate new revenue. You know, point of care ultrasound. Lots of organizations aren't charging for some of the point of care imaging that they've done. Telehealth rules are now going to allow providers to bill for looking at photos that their patients send them to determine whether or not they need to come in. So we're seeing some revenue opportunities there, which I think are really exciting.
Yeah, there's tremendous value in all of that data. When you look at a health system today, proportionally the infrastructure storage of images they're maintaining is anywhere from 80 to 90% of their entire patient data, a pool of information stored online or even archived. And it needs to be harvested for a number of areas, including obviously driving improvements in clinical care and harvesting that data for more advanced capabilities, as we're starting to see now when we talk about analytics and machine learning and applying that to artificial intelligence. So let's shift into how enterprise imaging is, and having a strategy around that is important for enabling these advancements in technologies that are really starting to take seed in the market and grow around AI and analytics.
So, you know, when I think about AI and analytics, we're really talking about the digital transformation that's occurring in healthcare, or that we're hoping will occur in healthcare, to really truly redefine the patient's experience. And that's, you know, we talked about big data. That's all you heard about 3 years ago was big data. But big data by itself is of no value. It's not until you take data and analyze it that you can actually start to get some knowledge and information. And so that's really going to be powered by AI. And we all know that mobile technologies are going to be enabling and supporting everything that goes on with digital transformation in the patient experience. I want to talk a little bit about what AI is going to be doing, both from a business and operational perspective as well as a clinical perspective. So when I think of clinical analytics, I'm really thinking about analyzing the image. And we can use AI to help improve overall image quality. We can help it to inform our interpretation of those studies. And with that comes the smart list, which might be able to analyze a CT of the head and identify those that have a potential bleed, move that to the top of our work list so we can get that information to the emergency department faster, thereby reducing the time to treat the patient, which is going to correlate with improved outcomes. And then through some of the precision diagnostics and precision treatment that we talked about, clinical analytics is going to help us improve the patient diagnosis. You know, just take the simple work being done on lung nodules to help identify nodules which have a high malignant potential based on things other than the features we have today, which are really size and a little bit about sharp, not sharp, and some calcium or not calcium, but there's a lot more information in that image that's beyond the scope of the human eye. Then we have the business and operational pieces, which are really going to help make the patient flow into and through the department more effective. We want to be more efficient. We want to be more productive with the time we use. Again, back to the modality work list is a very simple example of how some of this analytics can help us. And again, improving efficiency and productivity, in improving utilization. Overall, those things are going to help us reduce costs to the healthcare environment. And all of that's going to be supported by the standardized workflows and metadata that we already discussed. Again, I know, and I'm a clinician that doesn't always react well to this, that standardization is good when we talk about reproducibility and safety and efficiency. And same thing applies to enterprise imaging. It's easily replicated. It makes plugging in something new to our network easy because we're not recreating the wheel. We have a playbook. Of course, we're going to have to do some adjustments in that playbook for the new system that's coming in, but it's just tweaks. It's not redesigned work. And again, when all of this is standardized, that's what provides the most robust foundation for AI.
Thank you, Cheryl. Let's dive a little into the areas of, telehealth and mobility and getting to the patients and engaging them in their care and the impacts of that on wellness and population health. Seems to be a top-of-mind issue in the industry here more so than ever before.
Absolutely. So, let's take a look at how patients interact with their images. They're using mobile tools to share their images with their clinicians, and, those are really supporting all of our telehealth initiatives. And, the whole concept of telehealth is how do we, help improve getting the patient to the right provider in the right format so that we can have the best outcome for their patient. The universal viewer, I love this example of when you have the universal viewer open during a patient encounter in the office, and you could share the patient's images with those patients. What you've now done is convert the computer from a barrier in that interaction to an actual tool to enhance that interaction. And there's a lot of data out there that says patients being able to visualize their disease process, improve their identification and engagement with that disease process. And we know that that's important to help improve the patient's outcome. And then the portals, enable the patients to remotely view those images, which again helps support their engagement in their disease process. And in addition, those portals can also help them share that information with other providers, again, supporting the care continuum.
Yeah, let's move into another topic here in terms of improving the continuum. It's a big issue in particular in the U.S. As well as globally on connecting patient information and following that patient in the care delivery process, no matter where it occurs. Interoperability, image exchange, image sharing, those kind of things that enable such experiences to occur. Let's get a perspective on, from a Quadruple AIM perspective, how can image exchange technologies really reduce that burden on patients and providers and ultimately improve patient satisfaction and outcomes?
Certainly. So let's take a look at this. And, when we were talking about our stakeholders, what was one of the things patient desires? Patient desire access to their clinicians, but also access to their information, right? So what kind of access do they want? They want access to their images. They want access to their providers. They also expect that their providers are going to have access to every piece of information about them. And they are, frankly, appalled if I were to tell them, oh, doctors can't see all of your images, and if your images were done across the street, that doesn't mean your doctor has access to that. To them, it's unfathomable how that situation can happen. So what enterprise imaging is going to do is going to help them see those images on mobile devices. It's also going to help their providers see their images on mobile devices, and then they can share those images as they're rounding in the hospital. So again, we're now converting that smartphone into an actual tool that enhances the entire patient-provider experience. And then, as we've talked about, when you have centralized image exchange, you can set up robust programs for sharing that information with other organizations who are sharing the care of that patient with you. We haven't quite solved the problem even with the EMR, and image data becomes even harder to share just because of the sheer volume of the data that needs to be shared. But I think we have a great opportunity because we're aware of that challenge. We've seen what's happened, and we can do it right as soon as we implement an enterprise imaging strategy. And we can set the foundation for doing that from a single point. We've already talked about the benefits in terms of improved experience and care and engagement. But, you can't share, or it's a lot harder to share things when you have 5 points in my organization that need to share with 5 points in your organization, as opposed to 1 point in my organization that needs to share with 1 point in your organization. And again, once we have that 1 point to 1 point, we could start stepping up into that standardization and automation that we desire to help drive this whole system. And with that sharing and automation, again, we're going to reduce costs by preventing redundant imaging due to lack of access to outside images at the time of care. And I lost my train of thought on that one. So, excuse me. We just know that image exchange is going to be necessary.
Let's shift into a topic that's been around now for a number of years. HIPAA has been around for a number of years. Privacy, security, cybersecurity, top issues today as well in healthcare. Let's talk a little bit about how enterprise imaging strategies and solutions can mitigate that risk to the health system and, most importantly, to the patient.
So, research has shown that the weakest link in our healthcare organizations is the human being, that human error is responsible for the greatest number of data breaches. And so the way to mitigate that is through educational and awareness opportunities. So again, when you start consolidating teams, and those teams are highly skilled, they're going to be able to go back out and interact with the providers who are working these systems and educate those providers on the vulnerabilities in the systems and the ways to interact with those systems that are most secure. Again, by consolidating our archives and standardizing our procedures, we can eliminate some of those weaknesses that we know might exist. Some things that are passwords that are left default passwords, portals that are left open and not closed. And a lot of times this is done because some of the imaging systems are not managed by internal skilled individuals, but rather have a heavy reliance on the vendor. And, some of those connections leave opportunities. It's not saying that the vendors create the opportunities. It's just that the the communication pathway that might be constantly left open as an existing vulnerability. And then we know that we have a lot of inappropriate storage of image going on, whether it's on local PCs, whether it's on USB drives, CDs, or other smart devices. And I love one example of a loss of patient data was a physician was describing how he always stored his patient on a USB drive, and that USB drive was always hanging around his neck. And when asked, when was the last time he had it, he said, well, I saw it hanging on my neck and now it's not there anymore. I mean, that's just, not a secure way of managing our patient's information.
Yeah, no doubt. Cheryl, that's a frightening case there, and hopefully it's no one we know is patient information on that stick. Let's move into an area I think where, everyone knows what an EMR is today, and there was a lot of funding, a lot of billions of dollars funded to build and implement EMRs over the last decade and beyond. There isn't per se a known spec for enterprise imaging until recently. So let's talk about the HIMSS digital imaging adoption model and the importance of that, and for health systems in adopting that model to tackle a lot of the things we discussed today.
So I was honored to be one of the U.S. representatives that helped develop the digital imaging adoption model for enterprise imaging, and a lot of thought and care went into developing the model, and it's very forward-thinking. So it was really designed to represent not just what was happening today in enterprise imaging, but what future possibilities we see for enterprise imaging. And it's a great, aside from that, it really is a great model, and I think HIMSS offers a great service for people that are looking to develop an enterprise imaging strategy. It provides a roadmap. It also, HIMSS also provides tools so an organization can help assess where they are on that roadmap and what kinds of things they need to do to progress down that journey. And it also creates an awareness for our organizational leaders of what things we expect out of a mature digital environment for all of healthcare, and this speaks to the imaging component of that.
So I'm glad to see that there are standards and roadmaps to achieve to give health systems guidance, because in many ways it has been a free-for-all outside of the radiology and cardiology departments in recent years. I know we just have a few minutes left here, and we did have some questions come through as well. And if we could just take a minute to cover a couple of those. There was a question about the financial impact favorable for the provider, but a disadvantage for the patient in terms of some of the financial and cost reductions. I think in relating to that question, what I would comment back on is that by health systems being able to business justify the investments in these technologies, it will reduce costs for them to operate necessarily and also fund these types of investments, which traditionally have not been the case. So that's one area where I think financially it will help the health system. And then as a byproduct of having these technologies, the health system is better equipped to deliver higher quality, low cost healthcare for survivability in the market. So Cheryl, I don't know if you had anything to add to that question.
No, I think it's really a very interesting question, and I would love the person that proposed it to maybe give us an example of what they think would be a disadvantage for the patient. I would say from my perspective, everything is done to enhance the patient's experience, but also patient care. And what we want to do is take some of the burden off of the patient so that the patient, poor patient with a cancer diagnosis, that's already been to 3 hospitals doesn't have to go to all of those hospitals and gather up their records. But ideally, in a truly robust image exchange program, the tertiary or quaternary care centers that's seeing them would be automatically able to pull all of those previous studies, have them available in their system, provide them to their clinician when they're seeing the patient or before they're seeing the patient. I see that as a great win-win. We have patients trying to share information with our physicians on YouTube. I mean, where, nature abhors a vacuum, and when we don't provide a HIPAA-compliant, elegant, efficient way for patients and providers to achieve what they desire, they're going to go out and figure out ways to do it anyway. So
yep.
I really say that from the bottom of my heart, I see this as all about making it the best for the patient.
Yeah, great. Patient first. We had a question about Gartner or CLASS. Yes, CLASS has started in recent years to cover enterprise imaging in a variety of categories. Gartner, I believe, does characterize some of the archiving solutions out there for those interested for the question we received. Another question, what are the key leadership challenges of implementing enterprise imaging across a hospital healthcare ecosystem from the perspective of a lead clinician? Any tactic strategies to overcome these? Sure, I'll defer that one to you, having been down that road before.
Awesome, and this was really our last slide, so thank you to the person asking the question. And I think two of the biggest challenges that I see, and we'll talk in depth about both of them, one is deciding who should lead an enterprise imaging program, and where's the touch point in the organization that we in the industry should be approaching. It's not radiology in that in a lot of environments, the radiologists are third-party radiologists, and they are not actively engaged in organizational operations. So we need somebody who really has an enterprise focus. And to me, we've been really looking to target CIOs, maybe CFOs, COOs, or CEOs. They are the individuals that have the true enterprise perspective. And I think one of our things we've had to overcome is we don't speak C-suite. We've been doing a lot to talk really about what are the benefits to the clinicians and what are the technical aspects and challenges of enterprise imaging. But actually, our goal today was to put the language of the C-suite around enterprise imaging so that we can talk to those individuals and address the things that they are most concerned about. The second piece
well said.
that I think,
well said, Cheryl.
Thank you.
Go ahead. I'm sorry. Go one more point. Go ahead.
That I think has been a challenge is money. This is not. This is a multi-million-dollar endeavor in almost every organization. And I think we're starting to see an uptick in enterprise imaging purchases because we've been out there talking about this 5, 7, maybe 10 years. The VNA strategy, the VNA technology has been maturing. And now we have to capitalize on those compelling events of radiology or cardiology reinvesting in their current tax environments and teaching them that the investment in a true enterprise imaging environment yields multiple rewards for the organization. And if they're going to invest the money, let's invest it wisely and for the benefit of the entire organization. And I think that's where we are today as an organization. And I think we're going through that transition. Those of us who are actively engaged with talking to people that are interested in exploring an enterprise imaging opportunity. But it's really getting to the C-suite. I think that's where we need to be.
Great. Well, Cheryl, thank you so much for your perspectives there and the learning we absorbed today. Both Dr. Pertersilge and her firm Vidagos Advisors and Phillips can assist you in taking on that journey with advisory services around digital imaging adoption models. We have trained certified professionals. We also are working with our customers on that roadmap, and we have technologies and solutions that can take you all the way to stage 7 on that journey. So thank you everyone for your attention and joining our webinar today. And if there are any follow-ups, feel free to contact us. We'd be happy to work with you as well. Thank you.
Thank you, Frank.